Okay.
Hi, everyone. So good to have everybody. So sorry for that. We're running a little behind. We're having some technical difficulties. I just want to welcome everybody to our first episode of our mental health series. My name is Olivia Huffman, and I'm the owner and therapist at Huffman Counseling Services in Walker, Michigan. And we're just so excited to host this series. And really, we just want to get the word out there and answer any questions that people have. I know we're going to be covering several questions, and we just hope to really just be a help to our community and a support. So I'm going to go ahead and pass this over to our intern, Alana, who has done so much to make this event possible. I'm so grateful for all that she has done, and I'm going to pass this over to Alana.
Thank you, Olivia. Hi, everyone. I'm Alana. Thank you for joining us today. So this is our first episode of our first ever mental health series. So today we'll be covering therapy basics, and then next Thursday we'll have another one, and then the last Thursday of this month we'll have our last one. And also, if you're watching, we encourage you to like, comment, share this video, but also maybe like the page and support us in that way. Okay, so I would just like to say that we did have some difficulties, so today we'll only have Dina. Sorry, I forgot to pull something up, Olivia.
Dina, thank you so much for joining us. Dina is a licensed professional counselor who has their own private practice in Holland, Michigan. And we would just like to take a few minutes, and Dina, if you don't mind, just sharing a little bit about the work that you do and a little bit about your background.
Yeah, well, thank you for inviting me. I work primarily with adults. I do some adolescents. Age-wise tends to be like 15 and up. Bilingual therapy as well for those folks who, especially like parents who speak all Spanish and yet want to bring their teens in. That's kind of the time that I make the exception regarding the age. But my main focus tends to be on anxiety and depression, and then family issues, relationship stuff. Not necessarily couples counseling, because that's a whole different genre for me, but very much focus in on those areas. I consider myself to be a CBT therapist, cognitive behavioral health or behavioral therapy, and so very much focusing in on the things that we tell our mind, and then the behavior follows. So that tends to be the area that I work mostly in.
Awesome.
Thank you. So before we get started, I would just like to share a disclaimer. To always seek the advice of your physician or other qualified mental health provider with any questions you may have regarding a medical condition or mental disorder. Never disregard professional medical advice or delay in seeking it because of something you heard on this episode. So let's see. So I guess we can jump right in if that's okay with you.
Sounds good.
Okay, so what exactly are the differences between a psychiatrist, a psychologist, a therapist, counselor, etc.?
Sure. I can get started, and then Dina, of course, if you want to chime in. So I do get that question a lot from clients. What's the difference? I'll say I saw a psychiatrist, 5 years ago, a psychologist, a while back, and just kind of confused with all of that. And just to give a little bit clarification on it, so a psychiatrist is a medical doctor. So this person has gone to medical school and has completed medical training and is able to prescribe medication. They're able to diagnose and prescribe medication. And many years ago, a lot of psychiatrists would prescribe medication as well as perform the therapy. However, now just the way the system is, they're mostly doing med reviews, so prescribing medication and doing med reviews, and that leaves us as practitioners to do the actual therapy, and so that's a psychiatrist. Dina, I don't know if you want to share a little bit. I know you're a licensed professional counselor.
Right. And that you're absolutely right. I think probably back in the day it was a little bit different, but most psychiatrists now see people in 15-minute increments just to get the medication review. Plus, it's really, really difficult to get into a psychiatrist, a behavioral health one. So they very much, when it comes, or when they detect, at least this was my experience at Pine Rest, when they get a sense that people need therapy and along with medications, they will refer them to a therapist. And so that's kind of the nice thing of having a good working relationship with psychiatrists in the area.
Yeah. And there's also so there's licensed professional counselors, which is Dina. I'm a clinically licensed social worker, and so we're both able to assess individuals, diagnose, and provide treatment. And there's also psychologists, which we were going to have Dr. Doug Carpenter join us, but we're having some technical difficulties, unfortunately. But he has a doctorate, and he is a psychologist. And psychologists also perform therapy and treatment. And I really wish he was here because he could explain it, better. But to my understanding, they're able to do certain types of testing that usually us as practitioners we don't do. And I'm sure there's other tasks that he does as well, or that psychologists do. Also, you'll hear sometimes that a nurse practitioner will provide psychiatric services. So that's also somebody else that can provide treatment. So there's really a range of individuals. We all need to be have our masters and have postgraduate experience. So we have to have that postgraduate experience and work underneath a fully licensed practitioner. We have to take a clinical state exam. But that's just to kind of give you an idea. There's definitely a range. There's different roles, but there's several of us that are able to perform the treatment.
And I have found, like, in my working in different agencies, in different clinic settings, I find even if like a social work, LPC and LLP, the education piece tends to be very, very similar. I think they cover pretty much the same topics and themes, as far as the counseling field part of it. So really the main difference is like how you explained, where psychologists maybe specialize a little bit more in the testing field. Another prescriber that I have seen more readily is a physician's assistant. Now is also very much in the clinic settings that do the prescribing as well.
Okay.
Thank you so much. Yeah, there's a lot of different professionals that can help. And I don't think a lot of people realize that there's so many different options. So what would you say sets a Christian therapist apart from a secular therapist?
I'll go ahead and I'll jump in with that. The two agencies that I've worked at were both Christian agencies, and not necessarily as their main reason for people to draw people in. But a lot of folks, they'll seek out a faith-based therapist only because the faith part tends to be like that added tool to utilize as part of their treatment or their therapy. And for me personally, I kind of use the individual as a gauge as to how much faith plays a role in their therapy. So in my intake or my first meeting with that person, that's one of the questions I ask, not as a like weeding out kind of thing, but just to kind of get a feel for whether or not faith is something that they want to utilize as part of their therapy.
Yeah.
Thank you.
Yes.
Do you do anything different, Olivia, in that area?
Yeah, so I know that, in my intake process as well, that's a question, I just ask, do you have a belief in a higher power? Really, we're wanting to know, what are your supports? And, that's just something that, as a Christian clinician, if my client is Christian, we're able to utilize specific tools that maybe we're not utilizing with clients who are of another faith. So, for example, the biblical scriptures, we're able to utilize those tools, prayer, and whatnot. So, I think that really does, that sets us apart, where it's just this aspect that we're able to utilize specifically that maybe we're not able to utilize with someone of a different faith or background.
Mhm.
Right. Yeah. Thank you so much. So I guess from my own experiences going through things, maybe I wanted to talk to somebody and I would go to a mentor of mine or maybe even a best friend. So what would you say about the difference between talking to a therapist or another professional versus talking to that best friend?
Mhm. I can get us started with that. I know that I think it really just helps to get a different perspective, and from a non-biased individual, right? So many times you don't know your therapist, you don't really have this background, this long-term friendship there, right? And so it's almost like you're coming in fresh, and really, as a clinician, I strive to not cast judgment. So I'm just really trying to take the information in an objective way, to just help the client. How do we sort through this, and what pieces do we focus on? And as you can imagine, if you're talking with your friend just wants to typically side with you and like comfort you. And as a therapist, I want to comfort my clients too, but at the same time, we want to be constructive with the treatment and really help them overcome these issues. And so, really, I think it's just having that objective view, and with our education too, that's an added piece, where we learn different, like Dina was saying, our education is very similar. So we learn about, family dynamics. We learn about thought processes, and, how the brain functions and how it affects the rest of our body and whatnot. And so some friends might have that knowledge, but some friends might not. So you're just really getting just a fresh page, I guess you could say, objective view, and just a professional experience that we have with other clients.
Mhm. And to piggyback off of that, I a lot of times will explain to a client, especially one who's never been to counseling before, that the beauty of counseling is that I'm an outside observer. I'm not in their friend group or their family group. I'm someone who it doesn't have any reason to sway somebody either way. I'm just there to kind of guide them and be there along the journey with them as they discover new ways of even coping, new ways of thinking about things, or maybe getting a better understanding about why things happen. And I think this is where our education, our ability to take a situation and like an onion, tear it apart with them piece by piece and to understand. And where you're absolutely right, if you're a friend or family, chances are you're just going to be like, you're right, you should be angry, and not necessarily say, hey, well, let's look at it a different way, or look at it from a different angle. So yeah, that's definitely the difference.
Yeah, and you know what, you're reminding me of something where, especially if we're working through something like trauma, for example, I've learned through my experience, being able to assess whether a person is ready to get into certain topics. So, for example, a client might come in and say, I want to work on, this trauma, and while you're assessing them, realize they have no foundation of coping and they're not ready to, talk about those experiences and those images and those types of things. So as a professional, just being able to identify that, and not to say you have to be a professional to identify that, but that's just something we learn in our training where, okay, we're gonna just wait a moment before we jump into that topic, and we're gonna just work on healthy coping and get you at a stable level before we jump into that. So that's just something else I think that we do.
Yeah.
Thank you. So I thought of something else. So sometimes I find myself being that person that maybe the same family members go to or the same friends go to, and I'm the person who's maybe listening. How would you, if you're that friend who gets spoken to, how do you recommend somebody go to therapy? Or what might be something to say because you want to help somebody?
I would probably start. Sometimes the word therapy even kind of gives them a little different idea. I would even say, hey, you might be interested in talking to someone or seeking out counseling. And, whenever you make that kind of statement, though, kind of always be prepared with some resources, because sure enough, they're going to say, well, where do I begin? Where do I look? And so even if not that you necessarily have to carry around a list of resources, but even kind of know, like maybe Psychology Today, or if you know of somebody who's a good a counselor, being able to kind of steer them in that right direction.
Yeah, thank you. Olivia, do you have anything to add to that?
Yeah, I agree. I think there's a stigma right behind therapy, and so just being able to normalize it for them and let them know that sometimes we just need somebody to sort things out with, and yeah, just try as best as you can to normalize it. And like Dina said, having resources, it's great.
Right.
Yeah, kind of something that you just said, especially like in our culture, counseling tends to be something that's very frowned upon. It's, you don't talk outside the family, you don't share your problems. That's very much a part of the Hispanic culture. And so, like you said, normalizing it and letting them know, it's really okay to seek out help. It's really okay to talk to somebody who doesn't have any bias or objective or any motive that could steer you in the wrong direction.
That's good.
That's good.
Yes. Mm-hmm.
So if someone does decide to begin therapy, there are all different kinds of therapy, maybe even group therapy, individual, the CBT. How does somebody decide which type of therapy is best for them? Dina, if you want to start.
Oh, okay. Just like, finding the right connection with a doctor, you really have to find the right connection with a therapist. Even regardless of the type of therapy they use or techniques and theories, you just have to make sure that you're in a setting. I think Olivia said it earlier, where you don't feel judged, you feel safe, you can share whatever's on your heart. If you're sitting there wondering, is somebody going to judge me? Are they going to be shocked by my trauma or my history? Chances are they're not going to be as open as they need to be in order to get some progress in their life. I like to always start sessions by saying, I don't have expectations that you're going to, give me your whole life story. I understand that this is a process and we have to build that trust. And so it really is just kind of making sure that whoever you go to, and I've had folks come in and we're not a good fit, and it's okay to say so. Most therapists aren't going to be offended by that. They'd rather steer you in the right direction to get the right help.
Yeah.
Yeah.
Yeah, and it's true. It's like finding a doctor where sometimes it's not a good fit, right? Where you just as a client just either don't feel comfortable or you don't feel like you connected. And I always say give it a shot. Sometimes it takes like 2 or 3 sessions to build that rapport. And
Right.
as you can imagine, sometimes we go into these situations really nervous, really anxious, and so we're not necessarily able to look at all the information. But I just say, if it's not a good fit, it's okay. And there's a lot of us out there. So, and then what you were saying about treatment. So like Dina was saying, she has an intake process. I have an intake process. And what we're really trying to get to with that intake is getting a good picture of the client and able to really figure out what do we want to focus on in treatment. Because as you can imagine, there's like 10 different things going on. So it's like, okay, what are the top 3 that we're really going to focus on? And then really what we try to do is, okay, these are your goals. This is what you want to accomplish. And then we try to look at what treatment is out there that can help with those things. So like maybe it is this constant negative self-talk, like Dina, you were talking about, where maybe we use some CBT to identify those negative thoughts and restructure them in a more healthy way so we have better outcomes and behavior. Maybe it's a lot of trauma that somebody is going through. So there's therapy out there. There's several therapies out there for trauma. And so really it's just a matter of, we do the intake, we try to kind of zero in on what we want to focus on, and then try to find tools that would be best. Once in a while, I'll get a client who will request a specific therapy, and that's something that we talk about. So it really just depends on what your goals are, and also, taking into account recommendations from your practitioner.
Mm-hmm. Yeah, it's really true. That not all therapies work for all different, for the same type of thing. Sometimes it's almost like we have to be a buffet style kind of therapy, and here and there to make something fit right. But I think the biggest thing is to, like you said, to build that rapport and trust and feeling like this is a safe place.
Yeah, for sure.
Great, thank you. So you mentioned that sometimes a therapist might not be the right fit for somebody. And I know that maybe as a student, sometimes a teacher can make or break the class. So just an analogy for that. So what if somebody, they're not sure and then they stick it through a couple of sessions and they're not feeling it? How many sessions would you say before somebody switches or decides that they're not the right fit?
Yeah, I mean, I would just say, like Dina, you were talking about safety. And when we say safety, this isn't just, where I feel like my therapist is going to physically attack me. This is, just safety where you feel like you can open up, that this person is going to be like receptive, they're going to be understanding. You want to be able to feel safe like that. And if you don't feel safe, to me, that's something to look out for, like a red flag. So I don't know if I could give it a specific amount of sessions, but I would just say, just try to identify, is this me just feeling overly anxious? And as you can imagine, a lot of the issues we have, we've been dealing with them for a while. So just being able to identify, is this like my ambivalence or my hesitation just to get into all these issues? Or is it really just where this practitioner, I don't feel safe here to open up?
Along kind of that line, I have, as a practitioner myself, I will like 3 to 6 sessions to be able to say, hey, is there something that, more you're looking for? Are we on the right track? Just kind of making sure that they are feeling that, because you're right. How many of us have, well, me personally anyways, have stuck with a doctor just because we didn't want to, hurt the doctor's feelings, or, didn't want to try and find somebody else. And so as a practitioner, I gotta feel like it's my responsibility too, just to make sure that we're on the right track and they're feeling like they're getting something.
Sorry. Thank you. So, okay, so sometimes people choose to take medication, and sometimes maybe they do a combination of medication and therapy, or one or the other. What would you have to say about the use of medication for overcoming mental illness? And do you think it's necessary, or just what do you have to say about that?
There are lots of folks who are on the fence about the medications and counseling. I always explain it that they both work well together. But if you're, and a lot of people have a lot of fear, maybe it's the stigma part of it that, oh, I'm dependent on the medication for my depression. And I very much explain it. It's like any other illness, high blood pressure, diabetes, where we have to use medications to kind of control it. And the same thing with the mental illness medications. It very much needs to be normalized that it's just something else that you need to take. But if they aren't interested, then we really just kind of push the behavior therapy part to really have them work on their own to push through some of their struggles.
Yeah. Yeah, for sure. Yeah, I definitely, I'm not opposed to it. And I mean, I have clients on medication. I've referred clients to get an eval for medication. And really, I think, like Dina, you were saying, to just help them get to a more stable level. Especially if they're dealing with like a chronic mental health issue, or perhaps trauma, again, where, it could even be trauma from their past that resurfaced, and they're being triggered all of a sudden, or they're having nightmares. And, those nightmares are affecting their sleep. And, as you guys know, when you don't sleep, like that can lead to all other kinds of issues. So
Yeah.
I do recommend medication in certain situations to get them at a more stable level so that we actually can work through these issues. Definitely, I don't think it's necessary long-term in many situations. But again, just to kind of get them stable so we can work through things. There are certain illnesses that do require more long-term medication treatment. And I've seen this in, my work where if they're not on that medication, they're homicidal, suicidal, they're a threat to their surroundings. And really, we want them to be around people, right? Because that's a healthy thing and a form of coping. So if their symptoms are causing them to be a harm to others and it's isolating them, that's another reason where I say, okay, let's see what we can do to get them stabilized, and it might be a long-term thing for some.
Mm-hmm. And I found when folks actually reach out to their physician for medications, that it's this huge sense of relief. Like, wow, I wish I would have known a long time ago that if I would have just started on such and such a medication, I wouldn't be as anxious or I wouldn't be as depressed. But I think a lot of it's just a fear of kind of reaching out to say, hey, I need a little assistance.
Yeah, for sure.
So this is a little extra. Olivia, I know that with you and your practice, part of your intake process, you ask your clients about their overall health. When was the last time they saw their doctor? Is there something you want to add about that?
Yeah. I mean, that's something I think it's overlooked in is that whole physical aspect. And so as I think, Dina, you mentioned earlier, high blood pressure, diabetes, thyroid issues, chronic stress, other chronic illnesses, these can lead to mental health symptoms. And really, we want to rule that out. So, and I'm sure you do this, Dina, at your practice and at Pine Rest when you were there. And we're wanting to make sure that aspect is being covered as well. Because it really is not much use if we're working on these certain things when it has something to do with another physical illness going on. So definitely want to try to find a therapist that will take a holistic approach. I always try the best of my ability to get permission from my clients to talk with their primary care physician, and just to have that communication that we're providing treatment as well. So yeah, just trying to take that holistic approach.
And you're very true. It's true that, like in my intake process, one of the questions I do ask is, things like, do you exercise? What's your diet like? How is your sleep? And then one component that I think a lot of people are surprised about is, do you have actual pain, like physical pain, whether back pain, do you suffer from migraines, knee pain? Because without realizing it, it all runs together. So if you have pains in all of these areas, and you're wondering why, I'm so irritable, or I don't sleep well, or my blood pressure is so high, all of it runs together. And I think that's been a really healthy movement in our field, is to the recognition. It all, like mind, body, spirit, is all connected, and it's intertwined in this overall health, mental and physical health of the individual. So very much an important piece, like you said, to know whether or not they do actually go to physical, see a dentist even. I have found a lot of people like just taking in that information, that it is important enough that they actually start taking better care of themselves, which goes into like the self-care piece.
Yeah, for sure.
Yeah, and then just in case a viewer doesn't know what holistic means, could somebody maybe describe that?
Yeah, that's just really looking at the person as a whole. So like Dina said, mind, body, spirit, really I think is ideal treatment. So we're looking at the physical side, right? Is there pain? Are there any other issues going on? Mind, so when we think of mind, really it's just brain health, which is a part of our body, actually. It's an organ, right? But that's where we do, right, our thinking, our rationalizing. That's where our threat system is. So, I just say our alarm system, and that's where anxiety, that's where we feel that anxiety, it's telling us there's a threat. So we're taking a look at the brain and how it's functioning, and what are your thought processes. So it's interesting because we, given our upbringing and our experiences, we develop these like neurological circuits and these pathways, right? So we tell ourselves, for example, when I see this certain thing that makes me scared, I run away and I feel better temporarily. So it's this pathway in your brain you made, this road that says, oh, keep running away, because when you run away, you feel better. But we know that it's temporary. But there's pathways, these thought patterns that we have. So we want to look at that, and then also, spiritual. This our soul, right? We have this soul. We have this thing that can connect to that higher power. So we really want to, that was a long explanation, but holistic is just taking a look at the person as a whole.
Great, thank you. Dina, did you have anything to add to that?
No, I think Olivia explained that really, really well.
Okay. So I guess as we wrap things up, this last question is kind of really broad. So, and I think it's a good one to end on. There's definitely a rise in mental health awareness. However, there's still this mark of disgrace for mental illness, or some people don't even believe it exists at all. So how are some ways we can overcome this mental illness stigma in our churches, in our communities?
Yeah. So, it is a broad question. So maybe we could kind of break it up when it comes to church. And I'm sure Dina can speak on this, being a pastor's wife for many years. Again, if we're able to discuss mental health as, yes, problematic thought patterns, but also other physical things going on, and stress, not getting enough rest, not having a nutritious diet. Maybe we're eating a lot of processed foods, for example. When we can start talking about mental health in that way, I think that really can help individuals who may be within the church, or identify as Christian, who are scared to mention those things because they don't want to be, judged, or they don't want to seem like, oh, I'm not praying, I don't have a relationship with God. I think if we can talk about it again as that like holistic approach, that can help people within the church. So I don't know, Dina, I know with your experience as a pastor's wife, I'm sure you have something to share.
Yeah, for me, as I was looking at the question, one of the things that first came to mind was transparency. I think just us as mental health professionals, being transparent. I know when people found out what I did, what I went to school for, there was almost like not sure whether or not they could approach until I was open about the fact that I struggled with depression at one time in my life. And very much, you go out on a limb to say that because people question, well, wow, you must not be strong enough in your faith and all of that. But it actually opened the door for a lot of folks to be able to say, you know what, I struggled with that too. Mm-hmm. Because that transparency makes you relatable. It makes you human with these people. And even in my role as a pastor's wife, people knowing that I also struggled with that, lets them know that, hey, I'll understand what they feel. And then that kind of lessens the stigma, especially in the church setting. And it's super important because, I've had older Hispanic folks who've come into the office and almost like they had to force themselves to come in because right away conviction for themselves told them, oh, you shouldn't talk to somebody, you should just talk to God. But I fully believe that God puts Christian counselors on this earth to meet the need of other Christians because we want a good quality of life where we're happy and healthy and whole and in all the different areas of our life, and that's really what God has put us here for.
Yeah. And thank you for sharing that. Being vulnerable in that area, myself too, where we believe that the Lord, He can do anything. He's all powerful and He's able to do anything and heal. But as you guys know, sometimes it's about the process. And I know for myself, I went through some things, and I remember being at church, praying, in the altar area, and just kind of having, as we say, a breakthrough. And it was and some people think, okay, you had your breakthrough, you should be fine, just do your thing, you're good. But really, it was a breakthrough, and it was really the start to healing, and where I was able to let some things go. But there was still this journey of healing, and throughout that journey, that's where I learned, about anger, and that anger could be, it's usually a secondary emotion. There's usually all this other stuff going on underneath that, and so I was able to learn all that. I was able to learn about these negative thinking patterns I had, or these negative habits that I had. And I didn't learn all that at the altar, during that breakthrough. But I was able to, that was a start of it. And so I really think, the more we can present it that way, where it's, God can do whatever. He can heal diabetes. He can, heal a broken leg. But sometimes it's about that process.
Right.
So, and just moving along, because I think the question was within the church. I wanted to add too, I try to reach out. I've talked to some pastors in the area, and I think just having that open dialogue with them. I think this is kind of newer to the community, right? The church community, and the last maybe 20 years. So we're just keeping that open dialogue, I think, with the church leadership can be really helpful. And then I also saw just like within communities of color. You talked about this earlier, but it's not really talked about a lot. At least within my world, how I grew up. And to this day, I don't think my mom quite knows what I do. She's just like, well, that's nice. That's good. And, I'm okay with that. But at the same time, just being able to provide a safe place for people to talk, and normalizing, that it's okay to seek out help, I think can really go a long way for those communities.
And I think, events like this, and, I've been asked to join, even in our assembly, a bigger group of mental health providers just as resources. But it starts with just one person stepping out and saying, this is good for you, and like you said, making it, normalizing it for them, and that it's not so scary, and it's not wrong. That's really where it begins. It's people just kind of taking that step out.
Yeah, for sure.
Yeah, I did want to add something real quick about the church aspect, and about like how God puts people in our lives, that like therapists and things like that, and then it's like a journey. You can have that breakthrough moment at an altar, but then it's this whole journey. And one thing that I really like that God does is that he'll like let us go through situations, and then if we respond to him, he'll kind of work it out in a certain way. So he'll lengthen that journey. Maybe you had the breakthrough, but then you learn so much, and then you have this testimony that you can share with others, and it's that much more powerful because that you go through that, so that way you can connect to other people. So
Yeah.
Yeah, for sure. Yeah, I think, empathy. It provides empathy for us to, not that we have to be dealing with the same like addiction or relationship issues, but just the fact that, I've been, hurt, I've been to the ground, just being able to empathize with somebody, I think is such a valuable thing. And I want to be able to have that connection with people. And, I look back and I think, wow, when I was in that valley, it felt like forever. It felt like it was never going to end, but it's just so amazing where, when you cling to Christ, the outcome, it just makes you stronger, and, making more of an impact, connecting with people.
Right. Well, I think we've all heard that saying, that trials aren't made to make us bitter, but they're made to make us better. And if we, along our journey, collect and information and knowledge, it's going to help us in the next time that we have a trial or we have struggles. Because here on earth, we're going to struggle with grief and loss and trauma and, relationship and family issues. And all of those things that helped us in the past can help us now, as long as we recognize first that we need help.
Yeah, for sure.
And then, Dina, I think you mentioned something about maybe older people you've seen. I guess sometimes we see that stigma more with the older generations. Does either of you have something, maybe why you think that might be, or anything to add with that?
I think it's very much a generational thing. The older Hispanic population tends to be, very private, very, we don't air our dirty laundry kind of mentality. I am very excited to know that I have a whole slew of, 20 and 30 something year old Hispanic men and women, and benefiting from it. So that gives me hope that stigma is slowly declining and coming down, where, and not even just Hispanic populations. I have, different Asian populations, that stigma is huge in that culture as well. And as well as the African American culture, and being a person of color, it's very, it gives me a lot of hope that, they're actually seeking out help, and they feel that I can relate to them because of that. But it gives me hope that things are changing as far as viewpoint regarding mental health.
Yeah, for sure.
I am always excited when I have an older Hispanic person that comes and they're like, I wish I would have come 20 years ago.
Yeah.
That really makes my heart happy when they say that.
Yeah. And then that's really good for them when they say, I wish I did it sooner, and then maybe they could share that, or, you know, just depending on their comfort level, they could help normalize that in their generation or their communities.
Yeah.
for sure.
Did either of you have anything else to add about anything with the stigma? Anything else?
No.
Okay. So that's it as far as questions go. I did want to say or ask, do any of you have anything new in your practices where you work? Anything you want to share? I know Doug had a new book, so we were going to talk about that for a minute. I'll just open that up to you too.
Well, I mean, we're, like I shared, we're located in Walker, Michigan, and we're doing virtual sessions as well as in person. And just looking within the near future, possibly expanding. So, you know, we really just want to make a bigger impact in our community. We are accepting new clients right now, and you know, again, you know, we're just wanting to walk alongside you, help you just kind of navigate everything that's going on, and just getting a better focus and hopefully outcome with your goals. And yeah, you know, Alana, you shared about our series. We have 2 more episodes this month. I'm really excited about. We're going to have some more great clinicians on to share their expertise and experience. So all that information is on our Facebook page.
And like you had mentioned earlier, I am in Holland. Yes, doing virtual and in-person appointments. Always looking to be a help to whoever is interested in kind of delving into that story or that journey that they need to look into in order to have a better quality of life. I definitely like to see folks be successful and be happier and move forward. Do they leave all the time, you know, with 100% different attitude? No, but their baby steps kind of give you hope that they are taking in that information and utilizing it outside of the office and making a difference in their life. And I'm happy to help wherever I can, and so that's about me.
That's good.
Cool, thank you. And then, Dina, is it okay if I share your website with viewers if they want to
Yes.
look and gain more information? Okay, I'll do that.
And
Go ahead, Olivia.
well, if I could just throw in there, you know, we feel awful. We weren't able to have Dr. Carpenter on, and we'll have to try to get him back on and have him. He's got so much experience. He is a clinician in the Auburn Hills area. He has a private practice, several clinicians there. He and his wife run that practice. And he's just so knowledgeable and faith-based. And yes, like Alana said, he did just come out with a book, and I was hoping you could share that with us. And but it's from my understanding, you can check it out on Amazon. It's called Childhood Trauma and the Non-Alpha Male, and that's childhood trauma and the non-alpha male, and that can be, again, found on Amazon, and hopefully we'll be able to get him on one of our episodes coming up here.
Yeah, and thank you, Olivia. I can share his book maybe in the comments or something. And then before we wrap up, I just want to share about the next episode. So those of you who are watching, our next episode is next Thursday, March 11th, and it's also at 8 p.m. And that topic will be on child and adolescent mental health. So maybe if you know somebody who has children, things like that, maybe you want to share that with them, or just show some support in that way. That's it for me. Olivia, do you have anything else?
No, thank you everyone who's watching, who's watched, who's shared the event, and we're just excited to be able to put this stuff out there. So thanks for watching.
Yes, thank you so much.